Kidney disease is one of healthcare's biggest silent crises. Rapid growth impacts millions globally and alters care delivery and costs across the nation. As rates of chronic kidney disease and kidney failure rise, more patients are depending on costly treatments, putting enormous pressure on health systems. Today, we're breaking down what every healthcare leader must understand: the clinical reality of CKD, how dialysis works, the major players and payment drivers, as well as what the next few years look like for operations, strategy, and value-based care. If your kidneys lose function, they can't clear waste and fluid from the blood effectively, so treatments step in to do that work for them. Most people receive in-center hemodialysis several times a week, but some patients can use home therapies, like peritoneal dialysis or home hemodialysis, which offer greater flexibility and independence. Kidney transplant is the best clinical option for long-term survival and quality of life, but organ availability and matching limit how many patients can receive one. All these options carry high risks of comorbidity and mortality for patients. Therefore, policies are focusing on care coordination, home treatments, access to transplants, and mental health support. The dialysis market is dominated by large operators like Fresenius and DaVita. Medical suppliers such as Baxter and Outset provide machines and home therapy platforms, while providers and health systems deliver the care. Dialysis is paid for through a combination of government programs like Medicare and Medicaid, private insurance, and sometimes out-of-pocket payments. Most people with end-stage renal disease are eligible for Medicare, which covers a large portion of the costs, while private insurance or state-run programs can cover the remaining expenses or provide supplemental coverage. Successful dialysis organizations must cut costs and improve clinical quality. If you run a kidney care clinic or dialysis program, here are 6 priorities that will help you do just that. Number 1. Strengthen your vascular access and infection control strategy. Timely fistula or graft creation reduces complications, hospitalizations, and cost. Make access planning a KPI and invest in vascular access teams and tight infection protocols. Number 2. Build and scale home dialysis capability. Home therapies deliver patient flexibility and lower total cost of care when done well. That means investing in training curricula, airtight supply logistics, and a telehealth/remote monitoring wraparound. If CMS goals and value contracts push home-first incentives, programs that can safely scale will win financially and clinically. Number 3. Optimize care coordination and transitions. Post-discharge follow-up, transportation solutions, caregiver training, and early palliative integration cut readmissions and ED use. A structured handoff from hospital to clinic to home health, with clear accountability and scheduled PCP touchpoints, prevents avoidable events and improves patient experience. It is also crucial for leaders to assess the tools and strategies that enable you to achieve your goals. Use data and risk analysis to guide your choices. Keep an eye on your treatment methods, outcomes, reasons for hospital stays, and overall costs per patient. Create tools to highlight potential readmissions and frequent users. Predictive models can help you act early, like addressing social needs or medication issues before problems arise. Priority 5. Use technology and new ideas wisely. Look for simpler home devices and automated systems that ease training and reduce the need for nurses. Implement lab solutions at the point of care and strong telehealth systems. Remember, technology works best with good clinical practices and strong partnerships. Lastly, handle risks and seize chances. Be ready for staff shortages, transplant delays, supply chain issues, and changing rules that might affect profits. To succeed in the long term, focus on forming partnerships for dialysis and transplants, look into value-based contracts, and establish quality care networks. If you want a playbook for your team, drop a comment or visit WealthCare Inc. Let's build dialysis programs that are safer, smarter, and sustainable. Thanks for watching.